Hello, this is CityScape, a regular vodcast featuring people, place, and ideas that impact our community. I'm Dan West with the Livonia-Westland Chamber of Commerce. Today, we will explore Westland's emergency room and other medical services available 24 hours a day right here at the Westland Community Health Center. Garden City Hospital developed the Westland Community Health Center that opened in 2021 on Warren Road in between Naked Boulevard and Westland City Hall. It offers a freestanding emergency room and additional medical services compared to a standard urgent care clinic. Without a hospital within Westland city limits, this facility is the only 24-hour emergency room available inside the city, and it has the ability for direct admissions to Garden City Hospital for those who need inpatient care. For more on this, we're joined today by Dr. Kevin Tishkowski. Doctor, thank you for joining us today.
Thank you.
So, can you detail for us what's available here for patients at this emergency room?
Yes, this is considered a freestanding emergency department, which is really not a new concept in emergency medicine. It's actually been around for several decades, but unlike a traditional emergency department that is actually in the hospital itself, we are a freestanding site, meaning that we are in a separate building. But we still have 24/7 capabilities of emergency care with a similar complement of services that you would find in any emergency department. The whole notion is to bring 24/7 quality care out to the people in the community to make it more accessible to people in their own neighborhoods.
There's a difference in waiting times between a freestanding ER and the hospital ER. Can you detail that, how it's available here?
Yes, we typically have no waiting times, as you might see today. We typically have no waiting times. We don't compete with other services as you would in a normal hospital with inpatient beds and with surgical services, et cetera. So when people come in, we typically see them right away. There's no waiting times. They'll come back right away. And we have a full complement of services, including laboratory studies and imaging studies with radiology, such as CAT scans, ultrasound, and plain x-rays. So we have these departments readily available to us with no competition within the hospital. So we are usually able to get those studies done right away with quick turnaround times.
Are there additional things that you'll see in this ER compared to your typical walk-in clinic?
We're not an urgent care. We're a full service emergency department. So we are staffed by a group of physicians and nurses that are trained in emergency services. Our physicians here have been boarded and trained in emergency medicine, meaning that they have all done full 4-year residencies in emergency medicine and passed the national board certification exams to qualify to practice in emergency medicine. And most of the doctors here have actually practiced for decades in emergency medicine and high volume emergency departments. So we've got a lot of experience here as far as the staff goes. And we also, unlike urgent cares, we are a full service emergency department. We have a full backup of specialists, including cardiologists and neurologists and neurosurgeons and general surgeons, orthopedic surgeons, interventional radiologists, et cetera. So we have a 24/7 capability of obtaining consults with specialists at any time if we need backup for any kind of input into cases.
Can you highlight other services that are available here outside of the ER here at the Westland Community Health Center?
Yes, we mostly have the emergency department and then regular doctor's offices for family practice and internal medicine for follow-up appointments. And we also have rehabilitation services, physical therapy services here at this center.
So, all right, Dr. Tishkowski, thanks for your time today. I appreciate it.
Thank you.
When it comes to suffering from a heart attack or stroke, getting to a doctor as soon as possible is critical. Local residents can get to treatment faster at this Westland facility than nearby hospitals. We are joined today by two doctors that can elaborate on this. Dr. Ashok Kondur, a cardiologist, and Dr. Ramesh Madhavan, a neurologist, will highlight this a little bit more for us. We'll start with you, Dr. Kondur. For those having a heart attack, can you explain what is available here to provide treatment for cardiac patients?
People have a heart attack, anyone have some kind of chest pain, better to get to the emergency room. Here, this facility give a totality of care. They have on-site echocardiogram. They can do EKG immediately. If they find patient have acute heart attack, they can transfer immediately to the cath lab in the main campus, that's Garden City Hospital. So quicker the transfer, the time is kind of, muzzle is a time, right? If you're taking long time in the process of getting EKGs and workup, So you lose the muzzle, and also the mortality goes up, means outcomes may not be good. So that's why hitting to the emergency room right away, and they find patient have acute heart attack, we move to the cath lab immediately so that they can get a care right away.
So, can you describe what are typical symptoms you'll see with people having a heart attack? And if somebody sees that, how should they respond?
Any kind of chest pain. So we don't want to mislead the people. Any kind of chest pain. Okay, males always present like a 90% of the time. They present like a typical somebody crushing chest pain, elephant sitting on the chest sensation, jaw pain, pain between the shoulder blades. That's a typical presentation. When I come to the females, totally different. They present like a heartburn symptoms, sometimes like a pain in the shoulder. So if you have a risk factors in the family and you have kind of chest pain you never experienced, totally different, is better to seek a care, come to the emergency room. We need to work up like a heart attack. So more delay in accessing the care, and they do worse all the time.
Can you highlight what a few extra minutes of getting a patient to care that are having these symptoms, what that does for outcomes, what every few minutes can mean?
So every minute that counts, right? So like if the more delay seeking the care or transferring to the right center where we can open up the blockages and restore the blood flow to the heart muscle, more delay, like every minute it gets you 10% of the mortality. The 10% chance they're going down south and they may not have a good outcome. So sooner, that's why get to the Westland Community Center, they can do the EKG immediately. They identify whether the chest pain is from the acute heart attack or simple heartburn, and they can triage the patient immediately whether they need to transfer to the cath lab from here. Instead of transferring from this ER to other ER, they come directly to the emergency room there. So the interventionalist on call will be available 30 minutes, ready for the patient, lab will be ready so that we can take care of the patient immediately.
So, Dr. Kondur, thank you for your cardiology expertise. We'll now go to Dr. Madhavan for his neurology expertise. And
Hi
there. When it comes to a stroke, someone having a stroke, can you explain what's available for treatment here for those dealing with stroke?
So I'm sure everyone is aware that time is brain. And what we have done in the ER here in Westland is give everything that is available. We have doctors available all the time. We have a CT scanner, all the imaging facilities. We have a new technology called as tele-stroke program that is available where the neurologists, wherever they are, they immediately see the patient, look at the scans, and are able to treat the patient because we want to save the brain. Every minute, about 2 miles of brain cells are lost. And that is what we want to save. And if they come in, the faster the treatment and better the outcome.
So like Dr. Kondur said, every minute counts
Yes.
when you're talking about somebody dealing with that type of episode.
Yes.
Can you describe what are the typical symptoms people may see when somebody's having a stroke and how should people respond?
Yes, the easiest way to remember is to say that the acronym be fast. So anything to do with balance, anything to do with eye symptoms, anything to do with face drooping, anything to do with arm or leg weakness, anything to do with speech, time is critical and they need to call 911 or drive to Westland Community Center.
Okay. And can you tell us how telemedicine is helping you in the work that you do?
So telemedicine was started in around the 2000s, and now we have so far advanced that we are able to see the patient immediately, even on our mobile phones. And once the imaging is done, we are able to see the imaging and give the medication, because what we are trying to do is give a clot busting medication or go in and pull the clot out, and that is done in this ER along with the main campus hospital, which is Garden City. And we have, like I said, doctors available all the time. Just like Dr. Kondur said, the cath lab will be ready if the blockage is big. If the clot-busting medicine is only needed, we can give it even here in the ER.
Sounds very good. Well, Dr. Madhavan, Dr. Kondur, thank you for your time today. We appreciate you talking to us.
Thank you for this.
I want to add one more. We also do the clots in the lung, like pulmonary embolism, clots in the leg. So being a CAT scan available here 24/7, so if they find clot in the lung, clot in the leg, so they can identify and immediately we can transfer to the lab so that we can save their lives too. People have a clot in the lung, people 50% of the time, they don't make it through when they delay the care. So that's an additional advantage coming to the community care center here, Westland Community ER, and they can do immediate CAT scan without delay so that we can identify the reason why they're having the chest pain, why having a shortness of breath.
Well, gentlemen, thank you for your time today.
Thank you.
I appreciate it. So.
Thank you.
That's all we have for this edition of CityScape. We thank you for taking the time to watch us, and we'll catch you again next time.